Obligated on behalf of my state of Florida to explain why I unfortunately will not be able to support this bill on final passage. And I think in doing so, it's important to talk about why we're here and how we got here. I'm sure the American people think that in this process of debating health care over the past weeks and months, that this has been a process where both sides, Republicans and Democrats, have worked together, sat in an open room, and gave ideas back and forth. There's been give and take and compromise so that we could come to the plan that's before us here today. I'm sure the American people believe, Mr. President, that amendments were offered, that each senator could come to the floor and offer amendments, and that his and her colleagues were allowed to hear those amendments and vote them up and down. And I also believe the American people think, Mr. President, that we don't just come to this chamber and give monologues. They probably think that this room is not empty and that there's not just two of my distinguished colleagues here, but that we all sit here and listen to each other's arguments and try to decide what's best for the American people. But unfortunately, Mr. President, that's not the case with this bill. This bill was designed and crafted by the Democratic leadership without the input of the colleagues from this side of the aisle. There was no give and take. There was no back and forth in a conference room with C-SPAN in the room, as the president told us he would ensure when he ran for the office of the presidency. And we didn't have the opportunity to offer amendments to make this bill better. Now, I know that seems hard to believe, that we wouldn't have the ability to offer amendments to make this bill better, but I can prove it to you. Mr. President, I have an amendment at the desk. It's Amendment 3225. And what this amendment does is it takes a piece of legislation that I filed shortly after coming here to the Senate in September of this year, and it's called, the legislation's called the Prevent Healthcare Fraud Act of 2009. This legislation has 11 co-sponsors. It has bipartisan support. And what the bill does is basically three things. One, it creates the Chief Healthcare Fraud Prevention Officer of the United States. Be the number 2 person at Health and Human Services. Their only job would be to ferret out healthcare fraud. Second, it would use and take a page from the private sector to go after fraud. There is an industry out there right now that does an excellent job of stopping fraud, and that industry is about the same size as the healthcare industry. It's the credit card business. About a $2 trillion business. Healthcare is about a $2 trillion business. In healthcare and in Medicare alone, estimates are that 1 out of every $7 in Medicare is fraud. In the credit card business, it's pennies on the hundreds of dollars. How does the credit card business do it? Well, we've all had this experience. You go to purchase something at a store, and when you leave, you get an email or phone call, and your credit card company says to you, "Did you really mean to purchase that good or service?" And guess what? If you say no, they don't pay. The way we do things in Medicare and Medicaid is we do pay and chase. We pay, and then when we think there's fraud, we try to go after it. This model stops the fraud before it starts. And a group here in Washington, D.C. has evaluated this piece of legislation and says that it might save as much as $20 billion a year in Medicare alone. We think that there's $60 billion of fraud in Medicare, 1 out of every $7. And this bill, this proposal that we've put forward, also would require background checks for every health care provider in America to make sure they're not a criminal. Florida, unfortunately, my state, is ground zero for health care fraud. We have the worst health care fraud in America. Just this past week, and I've sent this letter around to my colleagues, $61 million Medicare fraud scheme out of Florida and some other states. My bill, this proposal, which has bipartisan support, could save $20 billion a year. And we have fashioned this bill into an amendment to this health care bill. And Mr. President, this time I would ask unanimous consent that the pending amendment be set aside to call up my amendment. It's Senate Amendment number 3225.
Mr. President.
Is there objection?
Mr. President, reserving the right to object, and I hope my colleague would let me just say a word or two in my reservation. The underlying bill, I might say, while I'm reserving the right to object, is crafted in a way with the guidance of CMS the Office of Inspector General, HHS, and the Justice Department for stronger anti-fraud provisions. It would give the CMS new screening authority, provide resources to the CMS for new screening authority, also limit providers and other ways, but more oversight when fraud is suspected, like limiting the number of durable medical equipment providers, because we know DME is areas fraught with fraud. We also, under the bill, require providers to have compliance programs, make sure providers know the rules, also increase penalties for fraudulent activity. That's in this bill too, as well, and help. But most importantly, this bill gives CMS, HHS, OIG, and DOJ more flexibility to use tools at their disposal to preserve and protect the program integrity. So the bill does a lot to protect fraud. I might say that, and I know this is on his time, but this is a bit unusual, this procedure here, and I appreciate the indulgence of the chair as well as the indulgence of the senator from Florida. But there were, you don't believe, Senator, the number of amendments that were offered on a bipartisan basis in the Finance Committee as well as the Health Committee, and were adopted in both committees. It's very, very transparent, very open, bipartisan. Unfortunately, by the time the bill got to the floor here, it became apparent that we're facing less in the nature of legitimate amendments, more of their message amendments, and so the majority resorted to a procedure to try to move this thing expeditiously. And I know that I'm taking advantage of Senator by explaining all this, when really that's not the proper procedure. But there are strong anti-fraud provisions in this legislation, and very, very, very respectfully, I must object.
The objection's heard.
Well, I thank my colleague and the chairman, distinguished chairman of the Finance Committee, and sure, there are things in this bill he has pointed out that go after fraud, but I would like to inform the Senate of the report that came out evaluating this new bill and the manager's amendment, and I have here a table which evaluates how much we'll estimate will be saved from the waste, fraud, and abuse provisions which are in this bill, and it's $0.9 billion. $0.9 billion. The proposal that I have, one group, and again, it's not the CBO, but one group has said that it might save $20 billion a year. So putting aside our differences, I sure wish we could talk about my amendment today. I say to my friend and my colleague, I hope that we can revisit it after this is over, because we should be able to agree, and it does have bipartisan support. I wish we could amend the bill today, but I hear the objection, and I will move on, but I hope that we can talk about this.
Mr. President, I might ask the Senator if he might yield using whatever time we might have on our side. I fully agree with the Senator. It is unfortunate that we can't proceed at this moment, but I pledge my support next year to work aggressively with very strong oversight to boost our anti-fraud measures even more than there are in this bill. There's going to be an awful lot of oversight necessary when this bill is passed to make sure that all the provisions that are intended actually come true. And in fact, we think we're working hard now to get this bill passed. Frankly, I think we're going to have to work even harder next year to make sure the provisions work. But I pledge my support to work very aggressively in that area. But I thank the Senator.
Thank you, Chairman.
Senator from Florida.
I wish we could, respectfully, I wish we could do it before we had to rush to judgment on this bill. I wish we had more time. I wish we didn't have to be backed up against a wall of Christmas. I understand our colleagues on the other side have the desire to get this done. But it's my concern with this measure and with the other measures in the bill that we could have worked together. Now, Mr. Chairman, Mr. President, and Mr. Chairman, you know, I'm new to this chamber. But this is not the way that businesses work. It's not the way that American families work. It's not the way that even state legislators work, which I have experience with in Florida. So I wish we could have talked about that amendment and offered it and talked about it. I wish my colleagues were here to debate it up or down. But let's talk about where we are instead. Let's talk about what this bill does and why I unfortunately can't support it as a senator from Florida. We know that this bill cuts Medicare by nearly $500 billion. We know that this bill raises taxes by nearly $500 billion. And we know it does not accomplish the fundamental goal that the President set forward when we embarked upon this debate about health care reform. The American people are beginning to realize, and if they haven't realized yet, will be shocked to hear that this bill is not going to cut the cost of health care for people who have insurance already. That's the very reason that this debate was embarked upon, not just access for people who don't have health care insurance, but to bring the cost down. Healthcare has gone up 130% in the past 10 years. This bill will not address that. In fact, estimates show that for some folks, the cost of healthcare will go up. So, Mr. President, there are basically 5 reasons why I cannot support this measure as a senator from Florida. I'm concerned, first of all, about access and quality of care for our seniors. When you take $500 billion out of Medicare, my fear is that it's going to diminish the quality of care for seniors in Florida. Now, it is said on the other side that we're not going to take away benefits, we're going to just take away money from providers. It's said on the other side that the new insurance will take care of uncompensated care, so the cuts to hospitals and the cuts to hospices and the cuts to other providers won't really hurt seniors at the end. I think that's a tremendously risky experiment. And I can't believe at the end of the day when we pay providers less that it's not going to affect benefits. Right now, the studies show that 24% of seniors on Medicare trying to find primary care physicians can't find one. I get letters from seniors in Florida who say they can't find a doctor who will take their Medicare. And we know in Medicaid it's worse. We know that in Medicaid, that if you're just going into the program and you're trying to find a physician, almost 40% of the physicians won't take it. And in metropolitan areas, for specialists, it's up to 50% who won't take Medicaid. I fear that we take nearly $500 billion out of a program that's already in financial trouble, a program that in the next 7 years is going to be in serious financial trouble and not be able to meet its obligations, that it's going to hurt seniors. Now, I've heard this discussion about how we're prolonging the life of Medicare, and the distinguished chairman just spoke about it. But when you look at what the actuary at HHS has said about that assumption, the assumption is that we're not going to restore the 21% decrease in physician payments, which, of course, as soon as we get back in the new year, we're going to have before us. You can't take money out of Medicare and pay for a new program and shore up Medicare. You don't need an actuary or an evaluation or an analyst to tell you that. It makes common sense. You can't get blood from a stone. And if the doctor is not in, it's not health care reform. I've gotten a letter, as many of my colleagues have, from an organization called 60 Plus, represents 5.5 million seniors. James Martin, the president of that, writes, cutting $500 billion from Medicare while adding 31 million more to the health care rolls is an outrage. 60 Plus strongly supports health care reform, but first we should do no harm to a system serving so many well. Make incremental changes that do not bankrupt a system already teetering on insolvency. I want to talk a minute about Medicare Advantage. More Floridians in Medicare Advantage than any other state. Lots been talked about this program. We've had amendments to try to stop the cuts. 950,000 Floridians. Now, Medicare Advantage is a great program, and people in Florida enjoy it. Seniors like it because you get more than just regular Medicare. You get eye care, you get hearing care, you get wellness, you get diabetic supplies and other things that add to the quality of life of seniors, help their entire health care. These Medicare Advantage providers are actually working hard to make sure that their senior customers are happy. You know, not really a concept that you hear a lot about when the government's in charge. Now, there is a fix for Florida, as been talked about. But I want to talk about what that fix is as I understand it. It is an off-ramp. For the rest of the country, it's going to be somewhat of an exit. In Florida, it's an off-ramp. First of all, we don't know what's going to happen in conference. The Senate cuts $120 billion. The House cuts $170 billion. I don't know if the Florida fix will still be there. But in talking to experts and reading the bill myself, specifically around page 895 through about 901 of the original Reid bill, there's this grandfathering in for folks in Florida and other areas, but part of Florida's covered. Of the 950,000 people, the experts think that 150,000 to maybe as many as 250,000 won't get this grandfathering in. They're going to get the cuts to Medicare Advantage. So this is not good for them. And then for the other, say, 700,000 people or so, every year starting in 2013, their benefits, or the payments to the providers for benefits, are going to decline 5% a year. That's on pages 895 through 897. So it's an off-ramp. Every year, less payments. Every year, less benefits. I talked to one provider down in Miami that many senators in this chamber has visited, who runs a very successful Medicare Advantage program. He said that these cuts would be devastating. So while it might not be an exit for Florida right away, it's certainly going to be an off-ramp that at one day ends up at being an exit. And let's remember that many of the folks on the other side of the aisle who are proposing these cuts to Medicare Advantage didn't vote for Medicare Advantage to start with. They don't like it. They don't like the private sector being involved. They don't like these extra benefits being provided. It goes against what they philosophically believe. But I know that Floridians like it. And because this bill cuts it, I can't be for it. And no one can guarantee me that in the next 10 years, Medicare Advantage in Florida will be as robust as it is today. I'm concerned also about the home health care payments. I'm concerned about what it's going to do to small business home health care providers in Florida. I talked to the largest provider of home health care services in Florida, and he said, we'll be fine, but the small businesses, the mom and pops who do this, they'll go out of business. That's disconcerting in a state with 11.5% unemployment. The second reason why I can't support this bill is that this is going to have a devastating effect on our state budget in Florida. We talked today to the head of the Florida healthcare system, the Agency for Healthcare Administration, and these increases in Medicaid, raising Medicaid from 100% of poverty to 133%, is going to cost Florida an estimated $3.5 billion over the next 10 years. $3.5 billion that Florida can't afford to pay. Our budget's gone from $73 billion to $66 billion in a short period of time with the economic decline. And unlike this chamber, which just spends money that it doesn't have, Florida has to balance its budget. So what happens when you have less money? You got to cut programs. But when you have a federal mandate, you can't cut that. So what do? You cut education and teachers. You cut law enforcement. Not good for Florida. A burden Florida can't afford to pay. That's why all of the governors in the country, virtually, Republican and Democrat alike, including our governor, Charlie Crist, are against this unfunded mandate. The third reason I can't support this bill is it raises taxes. $518 billion. And what happens when your drug company who makes your medicine or the medical device company that makes the life-saving implement for you gets taxed? They're going to pass it along to you. Mr. President, they're going to put it right in the bill. That's the way it's going to work. So that's why health care costs aren't going to go down for the 170 million some Americans who have health insurance. In fact, for some, they're going to go up. That's not health care reform. Fourth, this is a budget-busting bill. It is not deficit neutral, and let me explain why. You'll hear reports that this is going to cut more than $100 billion from the deficit over the next 10 years. Only in Washington, D.C. could you come to this calculation. It's funny math. We have this Congressional Budget Office, which is sort of the arbiter of all things financial here in Washington. You send them a proposal, they give you an answer. But it is not a thinking answer. It is an analytical answer. And it gets gamed. What you send them determines what you get back. They only look at 10 years of a period. What it's going to cost in the next 10 years. If you're going to bring in more money than you spend in the next 10 years, then it's going to cut the budget. It'll cut the deficit. That's what they say back to you. So what was done in this bill in order to get something that would fulfill the president's promise to be a budget cut or at least deficit neutral? We have 10 years of taxes and 6 years of benefits. Most of the benefits don't start till 2014, yet the taxes start in 2 weeks in January. That's like you going to buy a home, say, I'm going to live here for 10 years, and they say, well, that's great. Start paying today, and you can move in 2014. It's funny math. This is a $2.5 trillion new entitlement program that we can't afford. We can't afford the programs we have, let alone the programs that the majority in this chamber want. We have a $12 trillion deficit. We have $30-some trillion in unfunded entitlement deficit. Hundreds of thousands of dollars of debt for every family in America. and no plan to pay for it. We just spend more than we take in. We spent $1.4 trillion. We have $1.4 trillion deficit this year, just the debt this year. That's more than the past 4 years combined. And the American people are onto this, and they're angry about it.
Senators use 20 minutes.
And they should be. And fifth and finally, Mr. President, the reason I can't support this bill is it doesn't lower the cost of health insurance for Americans. The Congressional Budget Office has said the majority of Americans will see the same increases as they currently get under the current system. And for some people, individual policies, for example, they will receive a 10 to 13% increase. Mr. President, I'm going to conclude by saying this, and this will probably be the final time that I'll speak before we have final passage on this bill. I long for what could have been. We could have worked together. We could have had an 80-vote bill. We could have had a bill that would have said insurance companies can't drop you if you're sick. Insurance companies can't deny you if you have a pre-existing condition. Insurance companies can compete across state lines, set up an exchange, give a tax credit to the American people, put money in their pocket, let them be consumers that go out and buy health insurance and drive the cost down because the market economy would once again work in health care. This bill doesn't solve the problem. It just perpetuates it and makes it worse. And at the same time, it cuts health care for seniors and doesn't lower the cost of health insurance for most Americans. And for more and more seniors, the doctor will not be in. That's not reform. And for those reasons, Mr. President, respectfully, for that lost opportunity, I will not be able to support this bill. I yield the balance of my time to my friend and colleague from Alaska.